Welcome back to chapter 20. We have jumped ahead a few chapters, but while we're talking about how cells grow and die, it seems like a good place to throw in our drugs that we use to intentionally kill some cells. So, chemotherapy, what does that word make you think of? Probably makes you think of something like cancer, right? But honestly, chemotherapy means using a chemical as a therapy. So using a drug to treat a disease. It started with Ehrlich, if you remember, talking about him, his quest for a magic bullet, created salvarsan. Within this, there are two slightly different phrases that we can use. Antimicrobial drugs and antibiotic. An antimicrobial drug is a chemical that will interfere with the growth of microbes within a host. So chemotherapy here meaning disease, whether it's microbial or not. Antimicrobial drugs used to slow down a microbe that's growing. And then antibiotic, even more specific term, antibiotic refers to a substance, specifically one that is produced by a microbe. So something like penicillin, which is produced by a fungus. These are substances produced by one microbe that in small amounts inhibit another microbe. More than half of the antibiotics we use are produced by a bacteria called streptomyces. You may have heard of an antibiotic called streptomycin, named after the bacteria because it is produced by the bacteria. Although streptomyces is a bacteria that produces more than half of our antibiotics we use, there are actually a lot of different species that produce antibiotics. And one very important topic concerning a drug is selective toxicity. A good drug is going to kill the pathogen without hurting the host. If you have a drug that always 100% kills all pathogens, but also kills all the people that take it, you have a terrible drug. And if you have a drug that never hurts people, but it also never kills the pathogen, you also have a terrible drug. You need a drug that is going to consistently kill the pathogen and consistently be safe for the people who are taking it. Okay, when we're talking about antibiotics, here you can see some bacteria, gram-positive rods, such as Bacillus subtilis. This is one we use in lab, produces the antibiotic bacitracin. Paenibacillus polymixa produces polymyxin. Actinomycetes, we have streptomyces. Streptomyces produces amphotericin. Another species of streptomyces produces chloramphenicol. Another species of streptomyces produces chlorotetracycline and tetracycline. Another species of streptomyces produces neomycin. Another species of streptomyces produces streptomycin. Hopefully some of those sound familiar, or maybe not hopefully. Maybe you don't have much need to have taken antibiotics before. Some other actinomycetes, some other gram-positive bacteria. We have erythromycin produced by Saccharopolyspora and gentamicin produced by Micromonospora. Fungi can also produce antibiotics. Cephalosporium produces cephalothin, and then penicillium produces griseofulvin and penicillin. So these are things that this species makes to inhibit the growth of other species. So penicillin will inhibit the growth of other bacteria. That means the fungus which is not harmed by penicillin, is able to grow without having those other bacteria around it to interfere with it. So it's a natural selection for the bacteria to be able to inhibit the growth of other species to give it a better space. And we have just harnessed that as a way to prevent bacteria from infecting us. This is not a table to memorize. Do not waste your time on this table. This is a table just to be able to appreciate the contributions of microbes to giving us antibiotics. A few more vocabulary words here. Superinfection is an infection that develops during antibiotic treatment. Typically, this is going to be an overgrowth of normal microbiome and antibiotic resistance. I tend to think of C. diff, which is a bacteria that is actually present in most people's intestinal tract. But when you've been on a lot of antibiotics, your normal microbiome is killed off and it gives room for that C. diff to start growing. It's very antibiotic resistant. It's a terrible infection. Prophylaxis is treatment to prevent a disease. So prophylactic treatment is not waiting until you are sick to be treated, but beforehand. I see a lot of times advertisements for prophylactic HIV medicines. So people who are living certain lifestyles that are at increased risk of obtaining HIV, they can go on a prophylactic treatment to lower their risk of being sick. Empiric therapy is an educated guess. Sometimes you're not able to make a complete medical diagnosis to know exactly what a patient has, and you will have to just make that educated guess. And then efflux is one way that a cell can develop resistance. It is when a cell is able to eject the antibiotic. So instead of just letting the antibiotic come in and kill the cell says, nope, and yeets that antibiotic right out of the cell. Okay, penicillin. Penicillin is sort of going to be our model antibiotic we're going to look at. So I would like you to know pretty much everything we talk about penicillin here. So in 1928, I think we already discussed this story, Fleming had these plates he was growing bacteria on. Some of them just got left out for the weekend. He came back in and he saw that one of them had molded. And rather than just being like, waste of time, throw them in the trash, he stopped and looked at them. He had this nice scientific mind. He wanted to stop and look at what was going on. And he saw that where the mold was, he didn't have a lot of bacteria growing. And those bacteria that are growing there, they're not growing normally, right? Like you have these normal, nice, wide bacterial colonies. What's growing here, they're kind of just like little goosebumps on it. They're not, something is inhibiting these bacteria from growing well here. So he studied it and was able to isolate from this mold called penicillium. He isolated this chemical penicillin. By the 1940s, clinical trials had moved to the United States during the World War, and it became commercially available. It was very popular. It was just everyone gets a penicillin when you're sick. Who cares what you're sick with? You're sneezing, here's some penicillin. Your tooth hurts, here's some penicillin. Everyone got penicillin. It was wildly inappropriately prescribed, and very quickly by the 1950s, there started to be antibiotic resistance, which meant there were strains of bacteria that should have been killed by penicillin that were not being killed. When we are talking about drugs, especially when we're talking about empiric therapy, understanding the difference between a narrow spectrum of activity and a broad spectrum of activity is a pretty important topic. A narrow spectrum of activity is going to have a narrower category of bacteria that it can affect. So, for example, penicillin G is going to be really good at killing gram-positive bacteria, but it doesn't really kill much of anything else. So if you know your patient has a gram-positive infection, you can treat them with penicillin G, and you know that won't affect the gram-negative bacteria in their colon. So that's really nice to use. However, if you don't know what strain of bacteria is causing your infection, you don't want to risk using penicillin and not killing the infection. You're going to use something with a broader spectrum of activity. Something like tetracycline. Look at tetracycline here. It can kill this whole range, all kinds of prokaryotes. So broader spectrum of activities, they're going to affect more bacteria, both gram-positive and gram-negative. So it's more likely you're going to be harming your microbiome, but it's also more likely that you're going to kill whatever pathogen is causing the disease. So broad spectrum of activity type of antibiotics are going to be most useful when the pathogen is not known. Okay, again, these terms, bactericidal, bacteriostatic, make sure you review those if you don't remember them. So at this point, you can define the term chemotherapy. You can recall that more than half of our antibiotics are produced by a certain genus of bacteria. What genus is that? And how might an antibiotic with a more narrow spectrum be more useful than an antibiotic with a very broad spectrum? Okay, I will see you back for our next video where we're going to start talking about how some different types of antibiotics work. See you later. Bye.